6:36 on this Friday morning. Thanks so much for staying with us here on Arc Rochester. Cold and flu season is here, and for many families, that means reaching for over-the-counter medications. But are we always using them safely?
Yeah, Dr. Elizabeth Murray from Golisano Children's Hospital joins us this morning to walk us through how to read those medication labels, avoid common dosing mistakes, and also keep our families safe when they are sick. Thanks for coming in today. We appreciate it.
Glad I finally made it in. I was supposed to be here last week, but I myself was sick and had to reschedule. So yeah, it's here.
Hey, it happens to everybody. And, you know, you were saying that some of this you actually had to use.
Yes, this honey bear was significantly more full when I was originally scheduled compared to now, but that's okay. It did its purpose.
There we go. Yeah. There we go. All right, so let's get into it. Which side do you want to start with here?
So, you know, let's start with what we should be doing. So I'll give you guys each some of these. And so all over-the-counter medicines have drug fact labels on them. And I need to put my glasses on so that I can read them too. So if you were looking at it, you know, if you're looking at a medicine that you're at the store, you always want to read the active ingredients because you need to be comparing active ingredients. Or you also have to decide if, wait, what I'm considering purchasing doesn't even have an active ingredient in it. Is it worth it? So by law, they have to say what's in there, how much is in there, are there warnings you need to be aware of, what's the appropriate usage, and then other important information. So depending on what you're getting, you can see it can be huge. Often, some of the active ingredients are highlighted in yellow. So, you know, you guys, so what's interesting about you guys both have acetaminophen. If you turn them around and look, you're holding what's called children's acetaminophen. You've got infants. But look closely. So look at your active ingredients and read the dosing. So see how much there is. How much is in yours? 160?
160, yep.
Milligrams. And how much is in yours?
160.
Right. So we have medicines that are labeled differently that are exactly the same thing.
Oh.
And so it can be confusing, right? Because why am I buying one versus the other?
Yeah.
If you look at this packaging in teeny little print actually says same as children's acetaminophen in the bottom in a little teeny print.
Wow.
So this is just a teeny little bottle. So it actually ends up costing a lot more because you need to buy more of this. And so talking with your child's physician, an infant can actually take the children's. It's just the volume is going to be a little bit different potentially.
Wow,
yeah.
okay.
Yeah, so that's important. And so, yeah, looking at those active ingredients, and that's super important because, you know, again, we see about nationwide 80,000 children in the emergency department for medication overdoses, accidental overdoses, and about a third of those are related to just accidentally incorrectly taking the medicines. And so I think another big issue that comes up is combination medicines, and that can be tricky. So again, little children, we don't want to give them cough medicine. It's not safe for them. It just doesn't work. Decongestant's the same thing. But once we get to be teenagers and adults, it's understandable you want to reach the combination medicine. So the trick here is often you get an ingredient you don't want, and then often there's ingredients you forget are there, and they're not really in the right doses. So for example, this one includes acetaminophen, but not necessarily enough to get the right treatment level. So you might need to be taking extra in addition to this. Or if you don't realize it's in there and you have some aches and pains, you reach for some acetaminophen, you're accidentally taking too much. Again, when you get into the cough and cold medications, really be aware of the warnings, especially for adults who might be on other medications. Blood pressure medicines are the ones that are the big deal there for sure.
I'm really curious, with the active ingredient you often hear with food, serving size helps you measure. I see it says 5 milliliters. Is that typically the dosage that you would normally give to, let's say, a child?
So later on in the package, it will say the dosing, the amount. So in medicine, we make things a little bit more complicated. We think about weight in kilograms, and we use milliliters, right? So what does that mean? So it turns out 5 milliliters is technically a teaspoon. So the amount you give is really important, and that's why we really advocate for using some type of official medication dosing, whether it's a cup or a syringe, because if you use your home teaspoon, you're probably not going to get an accurate amount. Like this is a regular spoon from my kitchen. I measured it out. It's actually about 2/3 of a real teaspoon. So if I was to be using this, say my child needed a teaspoon of medicine, I would be giving the wrong dose, and so not getting full effect.
Wow.
So you want to be using this. So it's going to be some fraction or multiplier of a teaspoon.
Wow.
In general, a 1-year-old would need about a teaspoon of the children's medicine, but it's weight-based. So knowing your child's exact weight, talking to your pediatrician about doing a little math. Doctors will often give families charts that have the math done for you.
That's good.
We've got just about a minute left, so I want to talk about these things over here.
Yeah. So when you think about what works, okay, and so a lot of times natural, all that kind of stuff sounds really intriguing, but if you read this label, are there active ingredients there?
No.
And then, in fact, there's a little notation that says none of this stuff has really been studied. We don't know what works, right? So, a packaged product like that, it can be pretty costly. So what we know can be really helpful for children over 1 or adults who are having a cough, honey. Tablespoon of honey can be very soothing on the throat. Lots of new data coming out about saline nasal spray, really keeping the air passageways moisturized as much as you can be very, very helpful. Important reminder, allergy medicines can help with congestion if you're having an allergy, but if you're sick, they're not going to help with the congestion. It's a different mechanism there.
Interesting.
Yeah.
Wow. Okay.
All really great points.
Absolutely. And, I know that we're talking specifically about little kids too, but I'm thinking about kids that go off to college.
Yes.
They're alone, they get a cold or mono for the first time, and they're like, all right, I'm just going to take a bunch of this cold medicine.
Yes.
As a parent, like, what's your best advice?
And we definitely see that in the emergency department. So start early. We don't want little teeny children being too interested in medicines, but once they're in high school, having those conversations, teaching them, reading the labels, how are we deciding on what we're taking, what medicines treat what symptoms, so they are knowing to look appropriately and send them with the right stuff.
Awesome.
All right. Thank you so much.
Thanks, Doc. We appreciate it.